Hello, I'm Dr. Bhawna Sirohi. I specialize in GI cancers, and I'm going to talk to you today about pancreas cancer, which is part of the gastrointestinal system. Pancreas is an organ in the upper abdomen which has two main functions in our body. It produces hormones to regulate blood sugar and also produces enzymes which help us digest food. Patients with pancreatic cancer present late usually because it has non-specific symptoms like abdominal pain, weight loss, and jaundice. If you have any of these symptoms, please take advice. Pancreas cancer has certain risk factors which increase the chances of you developing pancreatic cancer. These are the use of alcohol, which may lead to chronic pancreatitis, smoking, genetic factors, especially some syndromes like Peutz-Jeghers syndrome, or if you carry this mutation, which is the BRCA mutation. BRCA mutation usually increases the risk of breast cancer, but recently has been shown that this is implicated in pancreatic cancer as well. In fact, all the international and our national guidelines now recommend that if a patient has been diagnosed with pancreatic cancer, they must undergo germline BRCA testing. To prevent pancreatic cancer, there are certain things one can do, which is you can avoid smoking, avoid alcohol, and if you have any symptoms, take early advice. If there is any family history of breast cancer, prostate cancer, or pancreatic cancer in your family, see a specialist and undergo genetic counseling. The treatment of pancreatic cancer is done within a multidisciplinary team which has a radiation oncologist, a medical oncologist, a surgical oncologist, and we are also lucky at the Proton Cancer Center to have a molecular oncologist, which is a very key part of treating patients with pancreatic cancer. Treatment is divided into curative and non-curative setting. In curative setting, most of our patients actually need chemotherapy and surgery. And the focus in early pancreatic or locally advanced pancreatic cancer these days is to give what we call neoadjuvant chemotherapy before surgery, even in patients who have an operable pancreatic cancer, because we know that the outcome of patients who have chemotherapy followed by surgery is significantly better than those who have surgery followed by chemotherapy, as about 50% of patients do not end up having chemotherapy. Treatment of advanced pancreatic cancer has had a huge improvement over the last few years, mainly because of newer chemotherapy agents and also precision oncology, which helps us treat patients better. Most of our patients with pancreatic cancer undergo molecular profiling, or what we call genomic profiling, which helps us target certain mutations in the cancer with drugs that have action on that mutation. My submission to all of you is, if you have any symptoms like abdominal pain or recent weight loss or anything that does not get better over a certain period of time, take advice from your physician. Thank you.